Hey everyone, welcome back to Medihedo, your go-to channel for all things health and wellness. I'm your name, and today we're diving into a lesser-known condition that affects many people worldwide, CREST syndrome. You might have heard of it before, but how much do you really know about it? Let's break it down. CREST syndrome is a type of autoimmune disease that's part of a broader condition called systemic sclerosis or scleroderma. It gets its name from the C in CREST, which stands for the different symptoms that make up the condition. Think of CREST syndrome as a catch-all for 5 symptoms that tend to show up together. And while it's rare, it can have a big impact on the people who live with it. Let's break down what each of these symptoms mean, starting with the C. First, we have C. calcinosis. This refers to the buildup of calcium deposits in the skin and soft tissues. These can form hard lumps under the skin, especially on the fingers, and they can be painful or even cause the skin to break down. While these calcium deposits are uncomfortable, they're just one part of the puzzle. Let's move on to the next letter, R. Raynaud's phenomenon is a condition where blood flow to your fingers and toes is reduced, often in response to cold or stress. This causes them to turn white or blue and feel cold and numb. It can be one of the earlier signs of CREST syndrome. Sounds pretty intense, right? But we're just getting started. The next symptom is EE. Esophageal dysfunction is a fancy way of saying that the muscles in your esophagus, the tube that moves food from your mouth to your stomach, don't work properly. This can cause difficulty swallowing, acid reflux and heartburn. Moving on, the next letter is S, and this one's a biggie. S, sclerodactyly, refers to tightening and thickening of the skin on your fingers and toes. Over time, this can cause them to become stiff and difficult to move. It can also change the shape of the fingers, making them look like they're pinched. Definitely not a fun one, but we've got one more symptom to cover. Let's talk about the T finally. We have T, telangiectasia. These are small red spots that appear on the skin, often on the face, hands, or inside the mouth. They're caused by dilated blood vessels near the surface of the skin. Okay, so let's do a quick recap. CREST syndrome includes the following symptoms: C. calcinosis, R. Raynaud's phenomenon, E. esophageal dysfunction, S. sclerodactyly, T. telangiectasia. And while these symptoms can be challenging, it's important to know that with early diagnosis and treatment, people with CREST syndrome can lead fulfilling lives. But what causes CREST syndrome in the first place? CREST syndrome, like other autoimmune diseases, happens when your immune system attacks healthy tissues in your body by mistake. The exact cause of this is still unclear, but both genetics and environmental factors may play a role. Women are more likely to develop CREST syndrome, and it often appears in people between the ages of 30 and 50. So what can you do if you think you might have CREST syndrome? First things first, talk to a healthcare provider. Early treatment can help manage symptoms and prevent further complications. Treatment often involves medications to manage the symptoms, like drugs that improve blood flow, reduce inflammation, and help with the skin tightening. In some cases, physical therapy or even surgery may be needed to improve mobility. Living with CREST syndrome can be challenging, but with the right support and medical care, it's possible to manage the condition effectively. And remember, it's always a good idea to check in with a healthcare professional if you're experiencing any of these symptoms. If you found this video helpful, don't forget to like, subscribe, and share. That's all for today's episode on CREST syndrome. If you learned something new or have questions, drop them in the comments below. I'd love to hear from you. And don't forget to like, subscribe, and hit that bell so you never miss a video from Medihedo. Stay healthy, stay informed, and I'll see you next time.